Meanwhile, the International Network for Economic, Social and Cultural Rights, or ESCRNet, has welcomed the call by UN experts for the governments of the world's largest economies to ensure equal access to COVID-19 vaccines in the global south countries. The call came just a few days before the meeting of the G7 world leaders in Cornwall in the UK. And the G7 summit is expected to announce a donation of 1 billion vaccine doses and also discuss rebuilding a post-COVID economy, amongst other issues. For more on the call to equal access of COVID-19 vaccines in the global south countries, we're now joined by Allana Kembabazi, who's the program manager at the Initiative for Social and Economic Rights in Uganda, which is a member of the ESCRNet. Thanks so much indeed for joining us, and welcome to the program.
Thank you for having me.
All right, so what is the situation in terms of the disparity to access? What's your assessment at this stage?
It is really shocking, the fact that we started off this year with so much hope, and by June 1st, 38.5% of vaccines had only gone to 16% of the world. Africa has received less than 1%. In Uganda right now, we are riding a second wave, which is affecting young people. In a matter of 2 weeks, we have received more cases than we received, I think, over 7 months, the last wave. People you're getting death notifications and hospitalization notifications of friends and relatives every single day. And at the same time, you are seeing pictures of people in other countries resuming life as it was, hugging relatives. Even at the G7, you could see they all didn't have masks. It's almost like they're living in a parallel reality. In a number of our countries right now, we are going back into lockdown. And you know, the very detrimental impact that lockdown has had on a number of us, particularly those of us with smaller economies. In Uganda and in many African countries, lockdown resulted in an increase in child labor. Our children have not been studying for about a year. They just went back, and now we're going back to lockdown. So schools are closed again, and the kids are sick. And businesses have just really suffered. Economic growth has really stalled. So vaccines have been touted as the quickest way to recover. And if you recall last year, when the discussion around vaccines was starting, it was so optimistic. I remember when Trump was trying to get some of the technology and trying to insist the US should basically, call dibs on some of these things. There was a strong reminder from countries like France and Germany that a vaccine must be a public good. And a year later, we are not seeing this. In October, South Africa went and said, people, we have been here before. We saw what happened with HIV. We know some of us in the poorer countries will be the last to receive this. Let's do it right from the start. Let us waive, let's ensure there's a TRIPS waiver, temporarily suspend patent protections so we can at least get this pandemic under control. It's a very modest proposal. Until to date, there's still European countries that are opposing this. So the G7, yes, is going on, but the WTO has also been sitting, and we're seeing them still dilly-dallying, yet time is of the essence. And the G7 right now is talking about donating, trying to get to 1 billion. We need billions of vaccines to vaccinate the world. We need at least 100 billion, according to, for example, Oxfam's estimates. So I very much agree with the UN experts, and we commend them for this, for re-emphasizing what we have always known. Access to vaccines is a human rights issue. It's not just about business as usual. It's not just about foreign policy or about innovation. It's about whether or not people live or die, whether or not our kids are able to go to school, whether or not people are able to earn a decent living and have access to food. And the fact that countries have stalled, and we've seen vaccine nationalism that has resulted in these same countries that are now trying to give us these meager doses, donations. The vaccine nationalism got some of them, like Canada, stockpiling 5 times what they needed to vaccinate their population. And now that they're basically done, they're like, oh, well, you can have a few more. It just seems very hypocritical to me, and it's very disappointing. And I also would add that if we are to truly sustainably deal with COVID, because now we see a lot of variants, it's imperative that we see real action on the TRIPS waiver. We must do everything in our power right now to increase the supply of vaccines by having multiple manufacturers. For those of us who have been relying on AstraZeneca, we were relying on the Serum Institute. And the Serum Institute, after what happened in India, is no longer supplying to us. So in Uganda, for example, vaccines are a hot commodity. We are running out. And it's crazy because thousands will line up to get a first dose with no assurance that they'll get a second dose. But the situation is so desperate that that's all we have. And these variants that are coming up in our country are not necessarily effectively dealt with the little, with the very few options we have, like AstraZeneca. I saw that in South Africa where they did experiments on, you guys were part of the experiments, are still not able to get these vaccines. And then you have to wait and see, oh dear, will the US, will the FDA, approve such a Johnson doses can come here? How did we get here as a world? How did we get to a point where inequity in access is just so normalized? And these other, the other international financial institutions also should be speaking out more strongly about this. We're a bit disappointed with the World Bank, for example, which is not supporting a TRIPS waiver, which does not make sense. Because if they're saying they're trying to help us build back better, to get girls back in school, everything is going to hinge on access to vaccines. And being able to have vaccines manufactured on the continent, manufactured elsewhere, such that we don't reach a situation where supply is monopolized like right now. Like the IMF director did say, vaccines are really like the best public investment in history right now. And the fact that there's artificial scarcity that we could change and there's stalling is really disappointing.
All right, let me ask you this, because one of the issues I remember was that we weren't ready. Even if we received the vaccines, we weren't going to be able to roll them out. So are we doing our bit? We can be crying for these vaccines, but if we're not ready to receive them and roll them out, then we also have to look inwards.
Yes, and I think those conversations can happen concurrently. I don't think that we have to prove to the world that, listen, we can handle vaccines before you give them to us. We are not children. We are all in this pandemic. And actually, the ones who are most affected were not necessarily the ones that played a very huge role in its spread. But getting back to, I absolutely agree with you that our national governments must do better. And I've seen mishaps. I have been tracking what is happening in South Africa, and I've been seeing what's happening in Kenya and Uganda, and they're very strong parallels as African countries in particular. You see that, for example, the vaccines come, there's supposed to be a plan on how things are done. We often very correctly identify the priority groups like older persons and healthcare workers and teachers. And then when it gets to implementation, we always drop the ball. You find that we have allowed the elite to jump the queue. I was saying in South Africa just how difficult it was for older persons, for example, to get appointments in this system, and yet others were getting vaccinated. In Uganda, at the start of vaccination, we saw social media influencers receiving vaccine doses before, and these were young people, before our health workers, before our older persons. And the challenge with haphazard implementation is that it erodes citizens' trust in government. And you need citizens' trust because they have to be able to trust that COVID is real, that vaccination will help. And so when you cut corners, when it's such a mess like it has been in a number of these rollouts, it does erode that. But I'd also add that the other thing that I think that our governments need to be doing is engaging with citizens and engaging with people at the community structures. Using the community structures, we have to say, why are vaccines important? And to dispel some of the myths we have around both COVID and vaccines. But those two things can happen in tandem, because as long as we have more supply, we end up in a situation with this artificial scarcity where, and I saw this in Uganda a week ago, thousands would show up and to get really chaotic, and then to be like, who do you know and who do I bribe to get a vaccine? Right. But that again is coming from the
Okay.
scarcity.
We're running out of time, but perhaps one final question, because it is about access, and I always fear for those in remote parts of our countries, remote parts of rural Africa. And are we making sure that even they get access to these vaccines?
I think what you said is very critical, and I'm disappointed to say that I don't think we are, as countries, making sufficient efforts. And I can give you a number of countries. I think in Kenya and Uganda and a number of these, you find that when you look at the figures, a lot of the vaccines have been distributed in urban areas, particularly because in rural and hard-to-reach areas, there's quite a distance to get there. You may not have good road network. It means you're forfeiting your entire day. Maybe you are supposed to go and dig, but you have to get there early. Like in our context, you get there by 6 or so forth, and then you wait, And so there has to be a real consideration about what are the additional barriers that people in rural and hard-to-reach areas will face. What are the additional barriers older persons will face? Because older persons are not able to transport themselves necessarily.
Allana, unfortunately, we've run out of time, but I'm really grateful for your thoughts and giving us this time to talk about this very important issue. Thank you so much indeed.